All right, thank you. Yes, so class, the last time we met, we were looking at anemia. Really, we've been having a lot of engagements here and there, the nutrition assessments, the nutrition interventions. We have also been looking at the various conditions from the diabetes, the hypertension, the chronic kidney disease. We have been looking at a number of things. On Saturday over the weekend, we were looking at anemia, really, the nutrition management of anemia, and also metabolic cases, really trying to explain the causes, the symptoms, and the consequences of anemia and metabolic stress. And also, we looked at erythropoiesis, basically being the production of the red blood cells. We looked at the hemoglobin production, things to do with the iron deficiency, and saying that this is the most common cause of anemia. We also were able to understand how iron is absorbed and distributed in the body, things to do with the cellular transportation of iron, things to do with the heme iron and the non-heme iron, and we got a distinction that the non-heme iron is that which is got from the plant sources, and the heme iron is the iron that is got from the animal sources, etc. We also saw the regulation of iron, looking at that balance between the iron intake, absorption, storage, and utilization. And we're also able to understand how we could try to manage iron deficiency, looking at oral or parenteral iron supplementation, etc. Looking at also other forms that could lead to anemia, the vitamin B12, the folic acid deficiencies, pernicious anemia also came out key, and also able to look at the metabolic response to stress, things to do with the inflammation, and also things to do with the vicious cycle of the immune system, and also the stress response. Really, the effect of stress on carbohydrates and also micronutrient metabolism was key. And also, lastly, I think we're looking at burns, where we're looking at a good question came in on how do we nutritionally manage clients who come with burns, and what we were looking at was really focusing on fluid and electrolyte balance or replacement. Uh, either due to enteral feeding and also other hypercatabolic responses that could happen if someone gets burns. So today, really, we are going to be looking at musculoskeletal disorders. When you hear the word musculoskeletal, really what comes to your mind is muscles and the skeletal system, I should say. Really, today we want, by the end of the day, by the end of our engagement, to be able to explain the role of nutrition in the prevention and treatment of these musculoskeletal disorders. And also, we expect you to be able to identify the nutritional needs and dietary recommendations for these people who will come with the different types of musculoskeletal disorders. And really, we also want you to be able to design and implement these individualized and evidence based nutrition care plans for patients with musculoskeletal disorders. Really, whenever we have our engagements, what I really tell us the different foods that are rich in those various nutrients that are indicated for the various conditions that we have. However, it is about you as students and also people who are engaged in this field of nutrition to go and try to write those foods down, come up with that plans on your own. We will go a little into the way how we could write these diet plans, but by now, I believe out of the topics we've covered, out of the conditions we've covered, you can at least design some diet plans, at least a week's meal plan or diet plan, really. For a particular condition, let's say hypertension or diabetes. And also, I should be able to evaluate the effectiveness of the outcomes of nutrition interventions for patients with musculoskeletal disorders. Okay, so when we talk of these, we are looking at these disorders that affect the movement of the musculoskeletal system, including the tendons, the ligaments, the nerves, the muscles, the joints, and also other blood vessels. that they're in. So for the common types, we have arthritis, all forms of arthritis. Then we have the gout, then we have the lupus, we have the fibromyalgia, the osteoporosis, which is often sometimes confused with the osteomalacia, but really a lot of those things are there. And today we are going to put our major emphasis on arthritis, or what people call arthritis. Then other people tend to term it as rheumatoid arthritis. Okay, yeah. So for the prevalency and impact, we are looking at these musculoskeletal disorders are prevalent and often work related. Okay. However, some occur naturally, but then most of them are triggered due to our work-related conditions. For example, for people who are loaders, for people who have their work environment where they need to be climbing steps every now and then. However, nowadays lifts have come in buildings whereby people no longer need to strain a lot, and also all those other good walkways and other information, other things that have come up. So that these commonly affect the parts that include the back, the neck, the shoulders, the upper limbs, and also the lower limbs. And here we are looking at chronic cases may lead to disability and work cessation. Remember when we were talking about the disability adjusted life years, where an individual is unable to do productive work due to being sidelined by a particular illness or a particular condition. So really, when we talk of rheumatoid arthritis or all these other forms of the musculoskeletal disorders, we are seeing that at a particular point in time, if it is chronic, it is long lasting, or people are suffering from it, or being exposed to this particular condition over a prolonged period of time, this could lead to a permanent disability. And work cessation, remember when you're disabled, you really can't work or do the work. So, what are the causes of these musculoskeletal disorders? We are saying they are multifactor, usually being a combination of different factors. From physical causes and risk factors such as handling loads improperly, repetitive and forceful movements, awkward and static postures, and this is very common for people who are working in offices. People have reported that they have undergone physiotherapy sessions because of their sitting postures, and also vibration, poor lighting, cold working environments, fast-paced work. This happens more in those manufacturing plants where any delay in the operation or production line would even lead to termination of your contract and etc. So these are things that really people need to take in emphasis on. Also, prolonged sitting or standing. This happens for the sitting. It happens basically more in offices, as for the standing bit comes for the people who are engaged in all different types of work. Could be still people working in the production line, people working in the industries, but it could also come to people serving us as the civil servants. For example, the teachers who stand for long, and also the policemen or the soldiers, the traffic policemen, etc. And all those other people are being engaging in those different types of work. So the types of musculoskeletal disorders we have arthritis, and these are coming from a Greek origin, arthron, which meaning the joint. Okay, and here we are looking at this arthritis, a condition that is characterized by inflammation between of one or more joints. Okay, resulting to pain, swelling, stiffness, and redness, and all those other things. And we will be seeing that there are different types of arthritis, things to do with osteoarthritis, the rheumatoid arthritis, and the psoriatic arthritis, and all these have different cases, and there are different ways in which they are treated and how they impact the individual who is suffering from them. So, yeah, looking at really rheumatoid arthritis, or what we can abbreviate as RA, this is really an autoimmune chronic inflammatory disorder that is affecting the joints and potentially the body systems. When we talk of an autoimmune response, you remember we said that autoimmunity means that the body is failing to recognize one of its parts as its own. So it is secreting antibodies or antigens from its immune system, trying to fight one of its own parts, for example, etc. And we saw this in diabetes mellitus type 1, where we're seeing that the body is secreting antibodies against the beta cells that secrete the insulin at the isolates of Langerhans, I should say. So, commonly, these inflammations will be at the hips, at the hands, at the wrists, at the elbows, the knees, the ankles, the arms, and feet. Okay. Yeah, and here the body, although people tend to say that it mistakenly attacks its own tissues, leading to inflammation of that synovium that is formed at those joints, or what we call the lining of the joints. And like what we've seen, it can lead to this joint damage, and also really at the end of the day, in chronic cases, it could be able to affect the eyes, the skin, the lungs, and also other blood vessels. And we will see that it could lead to disability, joint damage, and also loss of mobility, whereby now people may really fail to move at all. Okay, so what are the causes of this particular uh, condition, the rheumatoid arthritis? Okay, having said that, yeah, there is a combination of many of these. Having said that, it is an immune system which is attacking its own body parts, but really we can see inflammation of the synovium, and these are the effects. Like you can see the cartilage damage, the bone erosion, the joint deformity, and systemic impact. But when we are talking of the causes of this rheumatoid arthritis, as you can see in there, those are some of the symptoms and side effects. Basically, when we are talking of what leads to it, we are looking at genetic predisposition, and also this autoimmune response playing a key role. However, other things to do with the environment that could act as triggers to rheumatoid arthritis, and also an imbalance in the immune system. But the immune system plays key roles in the progression of this condition. So the side effects, as you can see, there is joint pain in the feet, the hands, and the knees. Then there are swollen joints, there is fever, there is limping, there is polyarthritis, then also other things to do with anemia, decreased saliva secretions, dysphagia leading to malnutrition. Remember when we talked of dysphagia, this is where people do not want to take in anything. So when we talk of medications for this particular condition, really we're trying to look at those medicines that are trying to reduce the inflammation, or the non-inflammatory drugs, for example, these non-steroidal anti-inflammatory drugs, these such as the ibuprofen, the naproxen, sodium, PC. These really help us in reducing the joint pains, and these are actually used as maybe you could call them painkillers, but really they're used for those short terms. Okay, yeah, and also there are other things to do. For example, which we'll see later on, that will help us in this arthritis. Okay, yeah, mostly it is to do with the inhibitors that are trying to prevent the immune system from attacking those particular tissues or those particular joints in the body. Yeah, so the medication still, we have steroids, for example, the prednisone, which reduces inflammation and pain. Also are trying as much as possible to slow down the joint damage. And the side effects, we are having bone thinning, weight gain, and this could lead to diabetes. So, as a nutritionist that is trying to indicate who is on the board that is trying to do an intervention on a condition that has arthritis, or on a patient that has arthritis, these are key things that you should look out for. That for a particular prescription that will be made, these are some of the adverse effects or the side effects that will happen for things that we have as weight gain, for things including diabetes, we need to be in position to understand that also those are other life-threatening factors that we need to take into consideration and develop our diet plans accordingly, or restructure our nutrition interventions in that line. So for the medications, still continuing, we are looking at the disease-modifying rheumatic drugs, or what we call the DMARDs. And when we are looking at these disease-modifying rheumatic drugs, such as the methotrexate and also the hydroxychloroquine and also the sulfasalazine. These are used to slow down the progression and also prevent the damage to the joints, I should say. So, what are the side effects? Here we have liver damage, bone marrow suppression, and severe lung infection. And you remember when we were looking at anemia, really was saying that erythropoiesis, if the first stage of erythropoiesis takes place in the bone marrows, where these cells are secreted, these unspecialized cells start to form therein. So we could have risks of anemia developing if someone is using these drugs. There is prolonged use of these drugs. So you, as a nutritionist, you should take all this into consideration when you're designing the interventions. So, therapy for rheumatoid arthritis, we have physical or occupational therapy. Here we are looking at doing those different exercises to maintain the joint flexibility and also adaptations for daily tasks to reduce joint strain. People have talked of developing and redesigning structures, different walkways. People have advanced and now are using trolleys instead of carrying lots of things on the backs, etc. Trying as much as possible to avoid those occupational hazards at the end of the day. So, surgery for this rheumatoid arthritis, we are looking at synovectomy. Okay, synovectomy, we are looking at the removal lining of that joint, like the joint where it is, but then that inflamed synovium, we could remove it surgically, and also things to do with tendon repair. Okay, yeah, and also when we talk of tendon repair, we are saying this can rheumatoid arthritis it can cause the damage to the tendons and the ligaments around the joints. So surgical repair or reconstruction of these structures really may be necessary to bring back the functionality of these particular joints. When we talk of joint fusion, really here, where in most cases we cannot replace most of these joints, we could try as much as possible to perform these joint fusions to relieve pain, and also in those places where that joint has been affected permanently. So we are trying as much as possible to bring back. And then at the end of the day, if things have failed completely, then there will be a total joint replacement. Okay, yeah, such as replacing. I think you've heard of people where they have had hip replacement or the knee replacement, and all these really might be necessary for people who are having or who are experiencing rheumatoid arthritis. So during this procedures, really the damaged joint surfaces are replaced with artificial implants, such as those plastic kneecaps, and what to restore the function and also relieve the pain from that the individual is suffering from. So when we talk of the nutrition therapy under rheumatoid arthritis, really we are trying to see what does nutrition do when it comes to rheumatoid arthritis. Okay, yeah. So here we are looking at energy as being a key nutrient. Okay, this nutrition therapy can help us in managing this rheumatoid arthritis. Really, when we talk of energy, we are trying as much as possible to increase, okay, on the amount of energy that is required for us to do these day-to-day activities. Okay, and also the thing. required due to the fever that could happen, and also post surgery. Protein, this is increased, okay, increased intake during the active disease periods. Remember now have to rebuild the tissue that has been destroyed due to inflammation. So if we need to rebuild this tissue, what we need to do is increase the protein intake. And also for the vitamins and mineral supplementation could be very key and essential, especially for the calcium and vitamin D. Remember, we are working on the tissues, including the bones that really require this. So we're using those fortified foods that can take in the foods really into that can deliver those nutrients that are required for bone absorption and all those other key things. Also, looking at other alternative methods that we could use, for example, these fish oils, or really we could be talking about only and only those anti-inflammatory diet indicated foods. Okay, things to do with the whole grain, walnuts, the fatty fish, those that are rich in omega 3 and etc. And also try as much as possible to minimize other foods that could trigger this rheumatoid arthritis, the sugary snacks, the processed foods, etc. And for these omega 3 fatty acids, really, they have been found to reduce the pain and the stiffness that could be caused by this RA, and also the potential side effects could be the nausea and the vomiting, but it is really a cheap price to pay compared to the overall dysfunctionality of that particular part of the body. Okay. Things to do with antioxidants, those ones have been mentioning the prolonged, the jingers, and etc. Plant oils, here they're looking at the black currants. This may help pain, and also the side effects could include the gastrointestinal issues. And also, here I think most of us have heard of Tai Chi, which is a gentle movement therapy with deep breathing that can relieve stress and avoid moves causing the pain. Really, this should be given by an instructor that is well trained. All right, so now let's shift and look at another form of arthritis, which is osteoarthritis. And osteoarthritis is really always confused with osteoporosis or osteomalacia, but really when we are looking at OA or osteoarthritis, we are looking at a degenerative joint disease or a wear and tear. You can hear the bones scratching against each other. Here, this is due to a breakdown in cartilage, leading to still the same things to do with the pain and also the stiffness. And really, this is the most common. However, we've seen rheumatoid arthritis being a key. But here in this group of arthritis, we see that osteoarthritis is really key and very common. And it's prevalent and it affects millions worldwide, accounting for 60% to 70% of these joint diseases. And it is a chronic condition, okay, and it is primarily affecting adults, people with increased age, or our geriatric individuals are having these challenges. So, what are the symptoms of osteoarthritis? Like we saw, not different or strange enough from those that we saw in RA. We are looking at the joint pain and stiffness, especially in the morning or after rest. We are looking at swelling, tenderness, and that cracking sound that you could feel when bones are rubbing against each other. Bone spurs or hard lumps around the joint. And also these are very depending on the severity and can affect the different parts, the hips, the knees, the spine, the hands, and etc. Okay, so what are the causes? Still same, and unlike the autoimmune, like the rheumatoid arthritis, we are looking at the joint injury or joint overuse. Okay, yeah, and also aging, primarily those above 50. So this risk of osteoarthritis increases with age. Okay, yeah, as really this part of the bone starts to wear down over the time you've taken. So also things to do with the genetics being a predisposing factor in developing of this osteoarthritis. When you have a familial history of osteoarthritis, then probably you too could fall culprit of getting this. And how could we manage this earlier on? It is if we understand that we are genetically predisposed to such a condition, then we tend to, as much as possible, try to develop our bone density, bone mineral density, or the BMD, when we are still in our youthful stages. Really, when someone has grown over the years, now the bone cannot be built strong enough, and etc. Okay, other things could be the overweight and obesity. This which increases the strain on the joints, because now the joints need to carry that huge volume. Okay, so this excess body weight puts that added stress to the joints. Okay, particularly those weight bearing points such as the hips that bear the weight of the upper torso, and also the knees that bear all the other increased weight. Also, we are seeing that. Other things such as the repetitive tasks and etc. Could lead to osteoarthritis. For medical history and diagnosis of osteoarthritis, here we take the medical history, we do physical examination, we do laboratory tests, we do the medical resonance, imaginary scan, and the x-rays. And it is suspected if the person is 50 years old, if joint pain is worsening with use, if morning stiffness is lasting less than 30 minutes, okay, then we start to think of rheumatoid arthritis, or sorry, start to think of osteoarthritis. So we've said osteoarthritis is a long-term condition with no cure, but symptoms can be managed. Really, things to do with this stiffness can be managed, and really regular exercises such as the physical activity, including the swimming, the walking, and all those other forms of exercises that people could do to try and keep these muscles functioning, and also these bones functioning, so that they do not cramp up and cause osteoarthritis at the end of the day. Weight loss, if someone is overweight, if there is a lot of weight that is being exerted on those joints, really trying as much as possible to alleviate these symptoms by trying to lose some weight could be key. And also wearing suitable footwear that could help you not put a lot of strain on these particular joints. People have talked of also other devices that could help people to have this condition of osteoarthritis, devices coupled with surgery if it is at its really end stage. For other medications for osteoarthritis, we are having these pain killers, pain killing medication, the analgesics, the acetaminophen, the opioids, these NSAIDs, the non-steroidal anti-inflammatory drugs, aspirin, ibuprofen, naproxen, the corticosteroids, oral or injected, the hyaluronic acid injection. All these are really trying to try as much as possible to reduce mostly inflammation, and also try to reduce pain, and also to rehabilitate the joints. So the occupation therapy for osteoarthritis, as we saw, that this could be a work related or in our work environment. So what is the role of occupation therapists? Really, this is something we tend to ignore as Africans, that even when someone is operating a very big company, they do not have money to pay for someone who is going to be involved in occupational health, which is really a big subject, since now there is a lot of industrialization going on in the different parts of the country where humans are being involved. I understand that there is technology coming up, but still we are still on human resource as the major or the primary source of the labor that is being used. So humans need to be treated differently from the machines. So people need to assess these occupational hazards. Okay, yeah. So the role of these occupational therapists is to find ways to perform these daily tasks with minimal joint pain. That's why you've seen the cranes coming up, the trolleys coming up, you've seen those elevators coming up. Actually, you see even before they construct a building, they first construct the stair, or those ladder things, or they construct the crane first, or that pulley system, I should say. For example, also recommending adaptive tools like toothbrushes with larger grips for finger osteoarthritis. Though this is not occupational, but we are trying as much as possible to show you. If I'm to go back a little bit, I'm going to show you one of the particular pictures I got for you. For example, for a person who has this rheumatoid arthritis or something like really that has not yet progressed, but it is bringing all this to their fingers, we could use those toothbrushes that are a little modified, that they can be easily gripped for finger osteoarthritis, and also installing benches in showers for the knee. Osteoarthritis so that people can sit down as they're bathing instead of squatting and all those other things. So movement therapies, we've seen this Tai Chi and yoga exercises that do not only release stress or relieve stress from an individual, but also they have the different breathing techniques that could even what I know about maybe yoga, I've had or I've seen some things from the different bloggers or YouTubers talking about these too. Really, it does not take away your stress or it does not take away your pain, but it makes you perceive pain differently. And when we talk of most of these things, if you people could go and interest yourselves and read about what is that trance state called? I'm forgetting. But really, it is all about perception. So when you divert your perception from pain, then that means your pain will be less and less. Or actually, I've remembered it's called hypnosis. For people who have undergone hypnosis, this pain can be given a different perception. And in most cases, people have gone through life changing episodes with hypnosis whereby instead of crying when they feel pain, they have been rewired to maybe laugh or maybe put on a smile during these painful episodes and etc. So maybe you could try out that etc. So for the gentle exercises, we have the stretches and also the deep breathing. And here we are looking at research indicates potential for reducing osteoarthritis and improving movement if these things are done. An emphasis on practices and avoid painful movements are guided by knowledgeable instructors. Do not go into every gym because someone told you they know a bit about physical activity or they've been through a physical education class that they know these different forms of relaxation techniques. Massage and other relaxation techniques. Here we are looking at this being able to alleviate pain or remove the pain and discomfort that is associated with osteoarthritis. And also, these are complementary to other treatment approaches. Remember, I told you that we do not work alone when we are working in the nutrition sector. Not even the healthcare professionals, not the medical doctors, it is what the pediatricians work alone. We all work as a team to deliver optimum health to the individuals. All right. For surgical options, like I told you, there was joint replacement surgery when the inflammation has gone beyond, and also this is considered in those severe cases when conservative treatments are ineffective. And also, procedure involves replacing the damaged joint surfaces with the artificial components, what we could call arthroplasty. So for the risks of this surgery, this could include infections and could also lead to blood clots, could also lead to potential wearing and also loosening of the artificial joints over time. So these need to be replaced every now and then. Okay, yeah. Really, that is it with this. But though we could appreciate that arthroplasty can help reduce the pain and also improve the functionality, though it causes a lot of those other issues. Also, maybe nerve damage could happen at the end of the day. So recovery often includes physiotherapy happening, then the rehabilitation to try as much as possible to enable you have uh, 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 these key this foreign or that part that is artificial to be more appreciated by your body at the end of the day. So the additional procedures that we have the neostomy. knee osteotomy, or I don't want to call it ostomy because we remember what ostomies are, but really it is knee osteostomy, which looks at a surgical procedure really that looks at realigning the bone of the knee joint. Okay, and this is due really it is more given, or it is more prescribed for the people who are a little bit young compared to those who are a little bit old, and it is typically performed under general anesthesia and etc. It is done in those early stages uh, where there are some types of knee deformities, such as for people who have those bullet, for the people with bullets, these knee things can be adjusted. Okay, yeah. We also have surgical realignment procedure for the knee osteoarthritis. This is really trying to explain what we have been looking at earlier. And also now let's appreciate the artificial hip replacement with advancement in research. Here we could call it hip arthroplasty or etc, which here we are looking at replacing the diseased hip joint with an artificial implant that will relieve that pain and also improve the function of that particular part of the body. Other prevention strategies, we are looking at posture. Try as much as possible to maintain good posture and also avoid prolonged periods of immobility. Try to walk around, even if your work tasks you could be seated on a computer if you're a secretary, if you're typing, or if you're doing other things. Try as much as possible to put yourself in that you stand up, stretch a bit, sit down, so that these parts of the body can do a little exercise. And also for the posture is really key, friends. For people, I don't know if you've seen that meme or that has been circulating all over social media, when we are now going back to that chimpanzee shape whereby now the back is very bent, okay, because we are overarching our backs on the computer whenever we are doing our different tasks. But really, posture is key. Some people sit on their backs; they do not use the buttocks to sit down well. They sit on their backs. Some people are sitting in very weird shapes. I hope you know what I'm talking about. Yeah. So also weight management is key. So maintaining a healthy weight, or this will help us reduce on the amount of stress that we are putting at these joints, hence lowering the risk of one getting this osteoarthritis. And also for weight loss can be beneficial for people who are overweight. All right. So when we talk of osteo, that was to do with osteo. So that was to do with osteoarthritis. But now let's shift and look at osteoporosis. And when we say osteoporosis, here we are looking at weakening of the bones. Okay, yeah. And here, this is a bone disease characterized by low bone mass and increased bone fragility or weakness of the bones, like I said. And this occurs when the body loses too much bone and makes too little bone, as simple as that in a layman's language. So this makes the bones a little porous and they are easy to break. Okay, and I'm very prone to those types of the fractures, like you saw, the compound fractures and etc. Okay, and this affects the areas like the hip, the spine, the wrist, and the shoulder. Really starting from the very top to rheumatoid arthritis, osteoarthritis, then osteoporosis. You're seeing that all these are affecting us almost the same parts, and these can lead to fractures, even if with minimal stress or impact. Okay, yeah. So differentiating between osteoporosis from osteoarthritis. When we talk of osteoporosis, we are looking at this affecting the density and also the strength of the bone. And often it is referred to as a silent disease, okay, whereby you can never know until you get that fracture. You can never know until you're trying to carry something and then you hear something, a sharp crack in your bone, or you can never know until you're playing soccer, or actually it is even not soccer, until you're moving just from one stair to another, then you feel your leg cracking. I have actually a very, very a disturbing case whereby we even lost one of our colleagues that were doing with our undergraduate degree. He reported having dislocated a joint, but then from that joint dislocation, I think that was not managed well. It resulted into a cancer. Then from that cancer, it is to which he succumbed. May his soul rest in peace. Yeah, but these are real issues that need to be tackled, and if there is evidence of limping, then try as much as possible to seek health services from a service provider that you know are close to you. Let's not take life for granted, I should say. So when we talk of osteoarthritis, we are looking at affecting joints and also surrounding tissues. Symptoms include joint pain, stiffness, and swelling. Really, bone health and aging, bone mass reduction begins after 30 years of age and accelerates in women post-menopause. Okay, yeah. So osteoporosis risk increases with age due to excessive bone reabsorption. Okay, yeah. So if to ask about the predisposing factor, we will have age here. It has been seen, and also the gender has been seen, and also low body weight. We could talk of underweight or people with these small bodies. Remember now, if you have small bodies, the bones are already out there. We could claim that they are very fragile, and then this could lead to the body frame, okay, increasing the risk to osteoporosis and also those other factors. We could talk of also things to do with poor nutrition, such as the vitamin D, the lack of physical activity, but really we could talk of also the estrogen, okay, and also the testosterone in men leading to an increased uh, risk to osteoporosis. Okay. Genetics that we've seen, the lack of exercise we've seen, and also the inadequate calcium and vitamin D intake. By now, I believe we know the foods that are very rich in these, and also if the foods are not being absorbed well, or we need a rescue, we know that we could use those fortified foods or we could use the supplements to help out. Also, personal history of adult fracture. I think there is also some assessment tool for this. I'm forgetting what the name of the tool is, but there is an assessment tool that will be asking you for how many fractures have you had in the past over 5 months, something like that. Yeah, cigarette smoking and excessive alcohol consumption could lead to osteoporosis. Okay, yeah, family history of rheumatoid arthritis, low body weight. This we've seen. We've seen the additional risks of age. For remember, bone reabsorption is higher as people are growing more and more, and also the risk factors to do with age and decreased bone density. We've seen sex women, especially post menopause, are the higher risk due to the estrogen levels, the people with the smaller bodies, and also the certain medications that could lead to this. Okay. All right. Drugs for cancers and seizures and also the gastric reflux can impact the bone health. Really, that is what we can talk of. For bone reabsorption, we are looking at this is a natural process whereby the bone tissue is broken down and removed by other specialized cells, and it only happens when people grow. I think we'll say that at the end of the day. So symptoms at the early stages, typically it is asymptomatic. You can never know. That is why we call it a silent killer. For the advanced stages, we have the back pains, okay, from fractures and also a collapsed vertebrae and also loss of height over time. That is why you hear people saying, I used to be tall in my youth, but then people start bending because of the vertebrae collapsing and also the stature reducing, a stooped posture, and also the increased susceptibility to fractures. Diagnosis X-rays may be used to suggest osteoporosis, bone density tests will confirm this, and also it is important if detected early, and so that to allow for timely intervention to avoid the condition from worsening. For the treatment approaches, we have those medications that are prescribed to slow bone loss and also reduce fracture risk, and also lifestyle changes such as ceasing alcohol and also uh, uh, tobacco use or a cessation of smoking. Okay, yeah. Regular weight bearing and muscle strengthening exercises, as we've seen throughout the arthritis engagement that we've had today, and also ensuring adequate calcium and vitamin D intake from those foods that are really required. Calcium adults age 15, adults age 19 to 50 years, at least 1000 milligrams per day. And then for the vitamin D, we are looking at uh, for the vitamin D, we are looking at yes, yeah, a moment. Sorry about that, friends. We're saying that for the vitamin D, we are also looking at 5 micrograms per day, just said based on age, sex, and also the condition, if it is the pregnancy or the lactation. All right, so friends, now let's look at osteomalacia. Really, we've seen osteoarthritis, we've seen osteoporosis, and now let's look at osteomalacia. And here we are looking at the softening of the bones due to impaired mineralization, okay, or due to vitamin D deficiency, as people could say. And also, these are more prone to bowing and fracturing, and the differentiation between osteoporosis with osteomalacia, we are looking at it resulting from a defect in bone building due to vitamin D deficiency, but as for osteoporosis, we saw that this is due to bone reabsorption at the different as the age goes by due to reducing in bone mineral density or BMD. Osteoporosis, we are saying it involves weakening and also weakening of the previously constructed bone, and the causes are vitamin D deficiency. The risk factors could be the kidney disease, the stomach, the gallbladder, and also the intestinal diseases, cirrhosis of the liver, and also known as adult rickets. Okay, for a person who was not bow-legged during their childhood, but then when you see them standing when they are now a full-grown adult, you're seeing their legs are bowed. So in the early stages, we are saying it is often asymptomatic, so you're not seeing any signs. But as the age goes by, the bones and muscle pain start to become present, particularly in the lower back, pelvis, hips, and the legs, and also the increased pain at night. And when the weight is placed on these affected bones, etc. So, what are the diet therapy for this musculoskeletal health? What do we tend to look out for? Okay, really, we are looking at energy needs, and these are determined based on the individual factors such as disease activity and physical therapy. But do not forget that some of these musculoskeletal disorders would be caused due to overweight or obesity. So we need to contraindicate, or we need to indicate, or we need to prescribe these calories or calorie requirement customized on the factors that are leading to or exacerbating this arthritis or the musculoskeletal disorders. Protein, this is just said based on the protein status and disease severity. And we had looked at the inflammation that is happening in most of these musculoskeletal disorders. So the breakdown in the tissue require an intake of extra protein to help rebuild some of those tissues that are being worn out. Vitamin standard recommendations here apply. Do not overload, because most of these minerals could become toxic if they are indicated in the body more than what is required. Okay, yeah. So things to do with fat, high saturated fat diets may accelerate progression of knee osteoarthritis. But remember, when we're talking of the omega-3 fatty acids and also those are olive oils that are found, and also the oils that are found in fish that help to reduce on the inflammation and etc. Coupled with seeking medical help and treatment and also physical activity, we could at least try as much as possible to bring back the people suffering from this to optimum health. But also we need to take key consideration in trying as much as possible to prevent this from happening, because as people say that prevention is better than cure, though the medical doctors don't want to hear that, because at the end of the day they will lose their consumer base or their customer base. But really, when we are looking at public health, prevention is really key. Okay, let's try as much as possible. If it is to do with occupational health, let's try as much as possible to bring the people who know a bit about occupational health on board, so as to try and reduce on the risks of these musculoskeletal disorders. So, friends, this is what I had for us today. I hope we have got something a bit to end here today's discussion.